Hello, and welcome to the Pharmacy Times News Network. I'm Nicole Grisano, your host for our Pharmacy Week in Review. Apalutamide, along with ongoing androgen deprivation therapy, demonstrated an overall survival benefit compared with a placebo regimen in patients with non-metastatic castration-resistant prostate cancer, Pharmacy Times reported. Presented at ESMO 2019, the data, which are from the Phase 3 Spartan study, further support apalutamide as a standard of care option in this population. For the study, patients with non-metastatic CRPC and prostate-specific antigen doubling time of less than or equal to 10 months were randomized to receive either apalutamide or a placebo in combination with ongoing ADT. In the second interim analysis, apalutamide was associated with improved overall survival compared with the placebo at 41 months of follow-up. The updated analysis also demonstrated that 4-year overall survival rates for apalutamide and the placebo were 72.1% and 64.7% respectively. The National Foundation for Infectious Diseases is continuing to urge U.S. adults and children aged 6 months and older to get vaccinated, Contemporary Clinic reported. CDC estimates show that the overall flu vaccination coverage increased over the past decade, with 51% of children aged 6 months to 17 years getting vaccinated between 2010 and 2011. However, data indicate that about 45% of United States adults remain unprotected each year. Vaccine hesitation is a public health concern across the nation, and Dr. William Schaffner, medical director of the NFID, is adamant about changing consumer perceptions. In his opening statement at the conference, Schaffner reminded the audience that unless we all start to prioritize prevention, vaccine-preventable diseases will persist in the United States. For the 2019-2020 season, vaccine manufacturers estimate that up to 169 million doses of influenza vaccine will be available in the United States. The composition of the vaccines has been updated to protect against the influenza viruses that research suggests will be most common this season. Pembrolizumab plus chemotherapy led to an increased pathological complete response compared with chemotherapy alone in patients with triple-negative breast cancer, Specialty Pharmacy Times reported. The trial investigated a regimen of neoadjuvant pembrolizumab plus chemotherapy, followed by adjuvant pembrolizumab monotherapy compared with a regimen of neoadjuvant chemotherapy followed by adjuvant placebo. Researchers randomized patients with triple-negative breast cancer in a 2-to-1 ratio to receive a 200 milligram dose of pembrolizumab every 3 weeks or the placebo. Patients received 4 cycles of carboplatin plus paclitaxel, followed by 4 cycles of doxorubicin or epirubicin plus cyclophosphamide. Following surgery, adjuvant pembrolizumab was continued for 9 cycles or until disease recurrence or unacceptable toxicity. Pembrolizumab plus chemotherapy resulted in statistically significant increase in PCR versus chemotherapy from 51.2% with neoadjuvant chemotherapy to 64.8% for neoadjuvant pembrolizumab plus chemotherapy in patients with early-stage TNBC. Pharmacists may get more questions about Eliquis if patients have seen a recent commercial for the prescription medication. In the spot called Around the Corner, Play, the narrator explains that almost 98% of patients on Eliquis didn't experience another deep vein thrombosis or pulmonary embolism once they started the medication. According to the commercial, Eliquis is a prescribed oral medication that is intended to treat DVT and PE while reducing the risk of blood clots when taken regularly as ordered. For more great coverage and practical information for today's pharmacist, visit our website and sign up for our daily e-news. And don't forget to follow us on Facebook, Twitter, and Instagram. Thanks for watching our Pharmacy Week in Review. I'm Nicole Grisano at the Pharmacy Times News Network.